Hello, my name is Maya Petrova. I'm a medical consultant of Neurosoft company, and today we will use Audio Smart device to perform tympanometry and the Eustachian tube function test. Tympanometry is a registration of the acoustic compliance of conductive system of middle ear, mainly tympanic membrane and acicular chain. Tympanometry is not so sensitive to the acoustic noise level as, for example, audioacoustic emission tests, but it's recommended to keep silence in your laboratory. Your patient needs to be relaxed, to stay still during the tympanometry, not to swallow and breathe very deeply during the tympanometry testing. It's not so hard because the registration of tympanometry requires only a few seconds. Before the positioning of the probe into the outer ear canal, we need to perform otoscopy to visually inspect the state of the outer ear canal and tympanic membrane and to exclude contraindications to such type of test. During tympanometry acquisition, plus TYMP unit is connected to the Audio Smart device with the help of special joint. We can put this unit in the holder, or if it is more comfortable, we can place it on the patient with the help of a shoulder belt. Before to start working with the device, we need to perform daily calibration. We go to the setup, system preferences, TYMP daily calibration. Device asks us to position the probe into the testing cavity, test cavity inserting in the holder, and press start. The calibration has successfully finished, and we go to the main menu. Before tympanometry acquisition, it's very important to select an ear tip of the proper size according to the size and form of outer ear canal of our patient. After that, the need to put it on a probe tip tightly. We are positioning the probe with gently rotating moves. Before starting tympanometry registration, we need to enter the patient data. Also, if our patient was studied before, we can search it from the base, but we have today the new patient, so we need to insert the patient's data. When they're finished, we put here. And now we can search the side. And the device will start automatically registration of tympanogram. We see here the tympanogram. Also, we can put here plus to register the new one tympanogram, for example, with another frequency of probe tone. We can search it here and choose and register another one, and we can see both the second and the first tympanogram here within the one study. Except the morphology of the result tympanogram, the doctor can also see the automatically estimated indices of compliance, pressure peak, volume of outer ear canal, and the gradient of tympanogram. For simplification of interpretation, the tympanogram, the system, gives us the window of normative data set for pressure peak and for indices of compliance, for frequency of probe tone of 226 Hz. Then we finished the registration of tympanogram. We push here. We can save the results. Also, we can print it via Bluetooth printer. When we save it, we also can import the results to the computer to see them via Near Audio Screen Manager program. To perform the Eustachian tube function of the patient with intact tympanic membrane, we choose the side and push. The device will automatically register the tympanogram on the relaxed patient firstly, and we can see here the pressure of peak of this tympanogram. We see that it's in normal value, 18 decapascal, and then we push this button and ask the patient to pitch the nose, close the mouth, and try to breathe out. Then push OK. And see the second tympanogram with the peak in 150 decapascal. So the differences between the second and the first peak pressure is 132 decapascal. And then we ask the patient to perform the Toynbee maneuver to pitch the noise and swallow. Press OK and register the third tympanogram. With the new peak pressure, they see that the peak goes to the negative indices, minus 172 decapascal, and the differences between third and the second peaks is minus 322 decapascal. And in the normal patient, with the normal Eustachian tube function, we need the differences between third and the second and the first peak pressure more than 10 decapascals. So after that they can save the results. Also we can print it via Bluetooth printer. After saving, we can import the results in the computer via Bluetooth and analyze it in the Near Audio Screen Manager program. AudioSmart has default templates to every type of procedure. To view them, we go to Setup and Test Settings. Before performing tympanometry, we can go Tymp Set, and we can see here two kinds of templates for tympanometry and tympanometry according acoustic reflex. The parameters of registration using this template can't be changed by doctor. If doctor wants something to change, he needs to create new template, to name it, and then we see that we can change some parameters. For example, I can change the pressure of start, and maybe I want to change the pressure change speed, and so on. When we finished the changing of template, we can go to the main menu